last century, the human lifespan has increased more dramatically than it has in the last 4,000 years. In the 21st century, people will be leading longer, healthier lives than ever before. And even though aging is a natural process which often entails physical and mental deterioration, older people, like people of any age, can strive for maximum quality of life. Today's tape is going to focus on the physical changes with aging and what you, the caregiver, can do to help the elderly maintain the best possible health. When working with older people, the goal is to maintain and, if possible, increase the amount of participation in life in order to promote physical, mental, and emotional health. Each person has unique needs and abilities. This is as true of the elderly as it is of the young. However, despite our individuality, as we age, we can all expect changes to occur in the systems that make up the human body. Although exactly what kinds of changes will take place and when vary greatly from person to person, aging is inescapable. It's part of the continuum of life. We're going to be looking at the physical changes of each body system as we age. Starting with the central nervous system. Many people think that the elderly have reduced mental capability. Though this is true in some cases, most people can maintain mentally active and vital lives even into very old age. Though the number of brain cells start to diminish after about age 30, there are plenty of brain cells in order to maintain intellectual function for an entire lifetime. In a healthy person, the change in mental functioning is minimal. Sometimes, though, you can see slower completion of tasks and slower decision-making by the elderly that may make it look like the older individual is having difficulty understanding. But this is not necessarily the case. It may be that the individual just requires a little bit more time for processing information and for reacting to it. I'm sure you have experienced zipping down the expressway, as I have, and getting behind someone who's poking along at about 40 miles per hour. As frustrating as that might be, you need to remember that the elderly person that very possibly is the one in the car is moving at a pace that is safe for them to be able to continue to drive. Mild confusion may occur with the elderly, but it's usually not part of the normal aging process. It can be due to medications, depression, or any number of medical diagnoses. Recently, I visited my parents who live in an assisted living facility, and my father, although he's wheelchair-bound, is very mentally alert. On Sunday afternoon, he asked if I would help him go to the bathroom, and in the process of transferring him from the wheelchair to the toilet, he was having a great deal of difficulty, so much so that I needed to have someone come and assist me. This was not my father. In addition, he was having difficulty remembering activities that we had just done. He was not able to recall what had occurred the night before, and I knew this was not part of his normal mental state. So we ended up in the emergency room of the hospital, where he was diagnosed with an acute urinary tract infection and dehydration, examples of what can cause mild confusion. After receiving some fluids to hydrate him and getting on antibiotic therapy, his mental confusion has totally cleared, and he's very mentally alert at this time. So be sure that you report any confusion to the nurse, particularly if it's something new because it might be a clue to something happening, a medical diagnosis that might be occurring or a new medication that might be causing it. Ways to help. Promote opportunities for intellectual stimulation. The saying, if you don't use it, you lose it, applies to brain activity as it does to muscles and other organs of the body. One is never too old to learn something new. That old adage that you can't teach an old dog new tricks really is not accurate. You can provide lots of opportunity for stimulation with things like challenging crossword puzzles, discussing current events, teaching them how to utilize email so that they can communicate with family and friends can all be ways to provide mental stimulation. Be patient with the elderly who are moving or speaking more slowly than you might like. Recognize that they're going at a pace that is safe for them and comfortable. By pushing them along may just increase their frustration and possible falls that can occur. The cardiovascular system includes the blood vessels and a heart. Natural changes in the cardiovascular system occur with aging and can have tremendous health consequences. The function of the heart, as you all know, is to pump blood through the body's blood vessels. In the older person, the heart may pump less efficiently. Blood vessels, or blood flow to the blood vessels, is reduced by about 1/3 by the time we are 60 years of age. Because of this reduced blood flow through the blood vessels, lots of times the elderly people have a sensation of cold. They feel cold much more quickly than we do. I'm sure you've noticed that elderly tend to be more bundled up than we are. Even on warm summer days, they'll be wearing long sleeve shirts or sweaters to keep warm. So remember, layering is important, and provide them with the extra clothing because of the reduced flow of blood to the extremities. Because of reduced blood flow, blood vessels respond slower to changes in body position as well. Consequently, rapid changes in body position, such as standing quickly, can produce dizziness. Maybe you've experienced jumping out of bed quickly in the morning and seeing stars, possibly, feeling a little dizzy, feeling that you could almost fall over. It's happened to me. It's a result of the blood pressure not having time to adjust to the change in position. It's even more pronounced with elderly people, so it's important if the person is in a lying position, help them to a sitting position slowly. Allow them to adjust to that sitting position, and then after a few seconds to a minute, have them stand. If the person has been sitting in a wheelchair, ask them to get to the edge of the chair and sit very upright and adjust a little bit to that position before attempting to help them stand. All these measures will allow the blood pressure time to adjust to the changes in position. Because the heart is less efficient, the elderly may tire more easily as well, and frequent rest periods may be needed. Factor that into your day. It's not uncommon for an individual after breakfast and bath to need to have a morning nap before they can partake in any other activities. Fatty deposits can form on the inner walls of blood vessels and cause narrowing and rigidity. Blood pressure can rise as a result of that. High blood pressure can damage the heart and kidney functions. Report any signs of high blood pressure. Some of the signs that the patient might report would be headaches, dizziness, flushed skin, or blurred vision. A healthy respiratory system, the organ that's involved in breathing in oxygen and exhaling carbon dioxide, is required in order to be physically active. Lung efficiency decreases with age. This is caused by years of exposure to harmful substances, things like pollutants in the air, tobacco smoke. Also, lung efficiency can be decreased due to lung disease. Breathing capacity of lungs is reduced, and older people expend about 10% more energy than younger people do to breathe. Lungs become less elastic, making it more difficult to cough and to expectorate phlegm and other items from the lungs. Elderly, as a result, are at higher risk for the development of respiratory illnesses and the flu. If you've been in healthcare facilities recently, you've probably noticed that there are signs everywhere in the halls and also in the elevators cautioning you that if you have flu-like symptoms or have respiratory problems, please do not visit the elderly and other compromised individuals because they are more susceptible to illness. If you, as a caregiver, have been ill with a respiratory infection and all the signs of the respiratory infection have gone except for a nagging cough, and it's probably all right for you to return to work, but it would be important that you wear a mask when you're around these residents if you have a lingering cough. Breathing exercises, elevating the head of the bed, and limiting exposure to others that are ill will help prevent respiratory infections. Healthy muscles and bones are essential for activity and posture. With increasing age, natural changes occur in the musculoskeletal system. There's a decrease in the bulk and number of muscle fibers. Though this leads to some loss of strength, endurance, and ability, the loss is not as great as one might think. In most people, there is still enough strength and agility to remain mobile. If any of you have watched the Boston Marathon, you will notice the age span of the runners goes from very young individuals to very old, as a testament to the fact that with practice and training, people of an older age can maintain a lot of muscle strength. Leg, arm, and neck muscles may become stiff, resulting in decreased range of motion. The cartilage of the joints can deteriorate, causing stiffening and pain, and reducing the ability to walk and maintain balance. Range of motion exercises can help prevent contractures. Contractures are joint stiffness that occurs and deformities, as well as range of motion exercises can limit the amount of atrophy, which is shrinkage of muscles. Every person should be encouraged and enabled to perform the maximum activity possible in order to maintain an optimal state of flexibility. Bone mass is progressively reduced with age. The spine and discs can narrow and collapse, affecting a person's posture and stature. That's what gives some elderly people a very stooped appearance. Some elderly lose 1, 2, and even more inches of height because of this spinal deterioration. Osteoporosis, also known as bone loss, may occur mainly due to a loss of calcium in both men and women, and estrogen, particularly in women. Bones become more porous, which can lead to fractures. Both men and women can reduce the incidence of osteoporosis by increasing their intake of calcium and certain medications. Calcium-rich foods such as beans, milk, cheese, yogurt, and other dairy products can help and should be a part of their diet. Exercise, too, will help maintain and even increase muscle and bone fitness. In fact, the reduction of exercise, often seen with older people who are afraid of falling, may actually increase their risk of falling by contributing to muscle and bone weakening. That means if you work in a facility that has both an elevator and stairs, if the individual is appropriate, assist them to take the stairs sometimes instead of always using the elevator. Walking, jogging, dancing, walking in place are all kinds of weight-bearing exercise can go a long way in helping keep an individual's physical ability the best it can. The gastrointestinal system includes the digestive tract from the mouth to the rectum. Of all of the body's system, this is the one system that's most likely to cause distress in the elderly. Eating habits can change with age. Sometimes this is because tastes change over time. In other cases, it can be due to chewing or swallowing problems. A lot of the elderly have dentures. With changes with weight, these dentures can become ill-fitting and make it difficult for them to chew and swallow. Also, it can be due to loss of an appetite caused by a diminished sense of taste and smell. Those taste buds sometimes aren't working as well as they could. In an older person, the intestines may have difficulty absorbing certain nutrients, and loss of muscle tone can reduce peristalsis. Peristalsis is that wave-like intestinal movement that moves food along in the intestinal tract. When it becomes sluggish, it can cause constipation. Encouraging fibrous and whole grain cereals such as bran muffins, broccoli, breads and cereals will provide bulk to help maintain normal stool formation. Provide fluids for the individual. Getting enough fluids can help prevent constipation. Though water is important, fluid of any kind can be used. Things like water-based soups, juices, decaffeinated tea are all things that can be used. Limit the amount of caffeinated coffee or other drinks, however, because they really act more as a diuretic than as a fluid that can help retain water. Be aware of food preferences and habits. For the most part, older people enjoy the same foods that they have always liked. That means if they are used to having meat and potatoes when they were younger, that's probably what they're going to want to eat now. Ask older people what their personal and cultural food preferences are. Many older people find that they need to urinate more often than they used to. By the age of 40, the kidneys begin to show evidence of wear, and by the time an individual is 80 years old, the blood flow to the kidneys has been reduced by an average of about 50 to 55%. This reduced blood flow means reduced functioning and filtering ability of the kidneys. The reduced functioning means that the kidneys get smaller and urine formation or production is less efficient. Muscles and ligaments in the urinary system become stretched from age, but also from childbearing years. This makes the bladder emptying more difficult, and nocturia, which means frequent urination during the night, and incontinence a potential problem. What this translates for you, the caregiver, is the importance of prompt assistance with toileting for these individuals. Older people, like young people, very young people, have difficulty holding urine, so respond to the call lights and requests for toileting as quickly as you can. Also, carefully following a bladder training program and encouraging fluids earlier in the day is important. Be sure that you limit the amount of fluid that's given to the older person in the evening and nighttime hours so that they are not interrupted a lot during the night. The integumentary system refers to the skin, hair, and nails. The skin is the largest organ of the human body, and no matter what the age, healthy skin is the single most important protection against health hazards. Skin loses the ability to retain fluid, making it more dry and prone to wrinkling. Limiting the frequency of bathing, sometimes only once a week or maybe twice a week, and use of lotions can go a long way to help prevent drying of the skin. Areas of brown spots appear on the skin of an older person. Usually these are on the hands or on the face. Sometimes they're called old age spots or liver spots. Actually, they have nothing to do with the liver, but rather are caused by a reduction in blood supply and hormonal changes in the aging process. Aging skin becomes thinner and more fragile and provides less support to the blood vessels underneath. The skin may tear and bruise more easily. Even a light bump, so light that the individual does not remember how it happened, may cause a bruise. This means that you need to take care when helping people, handle them gently, and avoid injury by being watchful of equipment and furniture that the individual might bump into. A while ago, I worked as a home health nurse. One day, I was just walking in the door of a home where a son was caring for his elderly father. The elderly gentleman was sitting in a chair, and not only did he have fragile skin due to his advanced age, but also he was on some corticosteroid medication, which made the problem even worse with skin fragility. The son was about to help his father out of the chair, and he grabbed the father's forearms to lift him up out of the chair, and in doing so, the skin literally rolled up towards him, towards the wrist of the elderly man, as the son pulled his father to a standing position. This certainly could have been avoided had he known or implemented safe handling of his father. Prolonged pressure over bony areas reduces blood supply to the tissues and can produce pressure ulcers. Frequent position changes, probably as much as every 1 or maybe every 2 hours, is necessary for those who spend a great deal of time in bed or sitting in a chair to prevent skin breakdown. Because aging usually means many years of skin exposure to radiation from the sun and other exposures, older people are at increased risk for skin lesions such as malignant melanoma, which is a very dangerous form of skin cancer. Help protect their skin from further harmful rays by using sun hats, long-sleeve shirts, and pants when going outdoors. Changes in texture, distribution, and color of hair also occur over the years. Loss of pigmentation typically turns the hair white or gray, and with age, men and even sometimes women will have thinning of their hair or baldness. This is due to hormonal changes and other factors. Fingernails and toenails can also become thickened and brittle as the age progresses due to poor circulation. Keeping nails clipped short and soaking nails in warm water before trimming to soften them can help with this problem. Even so, it may be necessary to have a professional take care of the older person's nails. Special senses, including the eyes, ears, taste, smell, and touch, also change with age. The human eye is so well constructed that it can be expected to function efficiently throughout life. But there are significant changes in vision that normally occur with aging. The fact that our eyes are used oftentimes, are donated to an eye bank, testify to the fact that eyes do last a lifetime and well beyond that. The lens of the eyes change shapes in order to focus on near and far objects. With age, the lens loses its elasticity and muscles may become hardened, making it more difficult for the muscles and ligaments to shape the lens. This can usually be corrected with bifocal lenses. That means it's important for the individual to have their glasses on if they are needed. Also, using large print material for them, audiobooks, and other visual aids will help with visual loss. Lighting, good lighting is another important thing, particularly natural light. So have open blinds and shades so that more natural light can come into the room and help prevent injury from falls. Another change that sometimes occur with aging is cataracts. Cataracts are the leading cause of blindness in the United States. The lens slowly becomes clouded with these cataracts and develop gradually and only obstruct the vision when they are located in the center of the lens. Cataracts affect more than 90% of the elderly over age 70 years of age. Cataracts can often be corrected with traditional or laser surgery. Glaucoma is also a common problem among the elderly. It occurs when pressure within the eye increases. Glaucoma can be treated with medication and, if necessary, it can also be treated with surgery. Macular degeneration might be a term that you're not as familiar with, but also it occurs with the older adult. You're hearing more about it than you have in the past, and is really a devastating eye problem because there's no known cause at this point, and the eyes just continue to deteriorate until blindness occurs. Though most people retain adequate hearing, it's not uncommon for elderly people to experience some loss of hearing. The decreased ability to hear, especially high tones, is often apparent by age 50 and becomes even more severe after the age of 65. Sometimes assistive devices, hearing devices, can reduce the effects of hearing loss, although the criticism of those devices is that it amplifies all sound, so hearing devices work best where extraneous sounds are limited. Because of high-frequency hearing loss, voices that are lower in pitch are heard more easily. Taste buds and smell receptors in the nose of elderly are less sensitive, so foods have less taste than they have in previous years. Providing additional seasoning, if allowed, and making meals more attractive to the eye, if they're unable to smell the aromas, may make mealtime for the elderly person more pleasurable. The skin, with all of its nerve endings, is also the organ of touch. Touch sensation may be diminished due to circulation problems in the elderly. Nerve damage can cause less ability to feel injuries or to sense hot and cold problems. Use care with hot water to prevent burns. Not too long ago, I was having some students in a long-term care facility, and I walked into the shower where some caregivers were bathing an individual. I noticed that the individual's skin was very red. When I tested the temperature of the water, it was 114 degrees. Many facilities have the water temperature set so that it cannot go above 105 or 110, but it was not the case in that facility. The older person did not sense the hot temperature, and as a result might have sustained some skin injury to her back, which was being showered at that moment. Touch is not only the means of sensory stimulation, but also an expression of warmth and caring. To hold a hand, rub a cheek, or pat a shoulder, basic as that might seem, can convey a message of friendship, warmth, and caring that overcomes the most severe sensory deficit. There's no age limit on the enjoyment one feels from a gentle, loving touch. If we're fortunate, we're all going to experience healthy aging. The older years are merely part of the continuum of life. They should not be viewed as the lesser years, but as a culmination of a lifetime of experience, learning, and sharing. All of us, regardless of age, should have the opportunity to live our lives with the maximum physical, mental, and emotional health that's available to us.